You know that familiar cloud of watermelon or berry-flavoured smoke you walk through on a night out? I do. Well, in 2024, that's set to vanish if the government's got anything to say about it.
3, 2, 1...
January 1st. It's a day for fresh starts and resolutions, especially if one of yours is quitting vaping.
The Commonwealth Government, along with all state health ministers, are determined to stamp out this public health menace on the 1st of January next year, from New Year's Day.
For months now, we've been trying to put the genie back in the Princess Peach flavoured bottle.
Big Tobacco has taken another addictive product, wrapped it in shiny packaging, added sweet flavours to create a new generation of nicotine addicts.
And today, the government finally unveiled the timeline of its major crackdown on e-cigarettes. From January 1, there'll be a ban on importing single-use disposable vapes. And in an effort to eradicate the black market, it'll become easier to get a vape prescription, with all doctors and nurse practitioners able to dish them out.
If you have a genuine therapeutic need for a vape, you can go to your doctor. They are able to provide you with a prescription. You can take that prescription to a pharmacy, not a convenience store, not a vape store. You can take it to a pharmacy.
I think Mark Butler's plan is doomed to failure. We've tried this pathway before. It hasn't worked. It's been rejected by vapers. It's been rejected by doctors.
Then from March 1, there'll be a ban on personal imports, with the importation of all non-therapeutic vapes. Importers will have to notify the TGA about their product and obtain a government licence. To enforce the crackdown, $25 million will go to the Border Force and almost $60 million to the TGA.
What has been announced today is a huge step forward, but it is one step of a series of reforms that need to happen.
But with vape culture now so ingrained in Aussie social scenes, will this be enough to turn things around?
We've known vapes are very harmful and deliberately targeted to our kids for a while now. There is so much to be done to address this crisis head on. Better late than never.
Around here we call Dr Sandro Di Maio Dr Vape, but he's actually a public health expert and he's been good enough to join us now. Dr Sandro, this is pretty comprehensive, stretching from our borders right through to retail. There's a lot here. Do you think the government can really make it stick?
Look, it's a great question, Walida. This is going to make a very big difference. This is world-first action and really puts Australia back at the forefront of global tobacco and e-cigarette control where we belong. It's a range of efforts and protections going from January through to March and beyond, and I think it is going to make a very big difference.
Doc, we've got a whole generation of kids now addicted to these things. If all these single-use vapes go, what are they going to turn to next to get their nicotine fix? Are they going to take up smoking again?
We have seen a rapid increase in the use of these addictive and toxic products in just a few years. We've got a range of services and supports in place ready to support, to help young people who are addicted. But the vast majority are not currently addicted. We're seeing an increase. We need to act early, and that's why this action is important. But, the evidence that we have is that young people are turning to these products because of the high concentrations, because of the flavours, the colours and the marketing. If you take all of those things away and you make the product really just available with a prescription and tobacco flavouring, the evidence that we're seeing is young people don't want to be addicted to these products and they'll very likely begin to turn away from them.
So, Dr Sandro, if we make it easier to get prescriptions, hopefully people are going to go, but is that going to bring the black market under control?
Look, the black market has emerged as a really purposeful part of the strategy by the tobacco industry. They've done this in many countries around the world. Flood the market with cheap imports, get young people addicted, and then say to government, oh, well, there's a black market, we should just all throw up our hands and give in. That would be a disaster. It would be another 4 or 5 decades of cleaning up the mess that we had with cigarettes. This is, not an easy solution. It's not a quick solution. It's not going to solve it overnight. But I think what they're announcing is comprehensive. Of course, enforcement will also be part of it, not coming down on young people themselves, but people who are illegally selling the vapes. These measures are meaningful. They are going to make a difference and they're balanced.
Now, Doctor, my radio co-host Brendan Favola said vapes are just fruit juice, mate. Don't worry about it. Is that solid medical advice?
Well, I'd say to Brendan, first of all, these vapes contain more than 200 toxic chemicals found in paint stripper, nail polish remover, rat poison, used in the production of industrial batteries. We're seeing now early evidence that it impairs brain development, it impairs heart function, it puts people in hospital, it blows up in their faces, and it causes landfill fires. So, no, I don't think these are just benign products with a fruity smell. The industry would love to tell you that, but it's absolutely not true. And the faster and sooner that we put protections in place, the better.
I mean, it's pretty alarming what you just revealed about fruit juice, Dr. Sandro.
Well, I mean, Waleed, we can have a conversation about fruit juice, but certainly when they're vaporised and delivered into your lungs, I'd be steering clear of it, whether it's fruit juice smelling or not.
He's good.
Okay, don't smoke fruit juice.
Dr. Sandro, I feel like the takeaway messages are vaping's bad and don't take medical advice from Fev.
Oh, he's one too, Coleman.
Dr. Sandro, always good to talk.
Thanks, guys.